Hello everybody. In this video, we'll learn about pupil examination and what is expected in pupils and what are the how do you perform the test and what do you look for in when you're doing pupil examination. So there are 5 components that you have to comment about: the size, shape, regularity, location, and reflexes. Okay, we will go into each one. The size. The normal size of the pupil is around 2 to 4 millimeter. It can vary in individual, but it'll be the same on both sides. Please remember. When will it be dilated? Sometimes you'll see that the pupil is larger than the normal size. So three things can be the cause. One is pharmacological, where we've used some pharmacological dilating agents to dilate the pupil. It can be a third nerve palsy, where there's the sphincter pupillae, the nerve supplying the sphincter pupillae is damaged, and then you will see the pupil being dilated, or traumatic, where you'll see sphincter tears, and you will see that there is mydriasis, or the pupil is dilated. Now, the shape of the pupil. Normally, the shape of the pupil is round, okay, but sometimes you can see it as oval, like a teardrop, which we call it as peaked, or it can be horizontally oval, where you see post trauma or post surgery, post cataract surgery. Also, you might see that the pupil is peaked, either because it is lifted because of a vitreous strand or attachment to the capsulotomy from behind, or when you see horizontally oval pupils, probably a iris claw lens has been implanted. That's when you see a horizontally oval pupil, or it can be D shape. So, okay. So if you draw a line, it is straight and it is D shape. This is usually seen in iridodialysis when there is detachment of the iris from the root. That part of the pupil becomes straight. Okay, and the remaining part is round. I mean regular and curved. But the area where the iris is detached from its root, it becomes straight. So this is a very typical. You call it as D-shaped pupil. When you see D-shaped pupil, you have to look for iridodialysis on the side where the pupil is straight. Now coming to the next one is you look for regularity. The normal pupil is regular. Okay, this is how you see a regular pupil, around 2 to 3 millimeter round regular pupil, but it can be sometimes festooned. Okay, where it is irregular. Certain places the iris is attached to the lens capsule behind because of posterior synechia, and you see that the pupil is irregular and is festooned pupil. This you see in case of uveitis. Okay, then the location. Normally, again, the pupil is central. Okay, it's in the center of the iris, but sometimes you might see that it is drawn downwards. In case of coloboma, you'll see it is drawn downwards. Uh, your books might also say that there is polychoria. It is very rare. You don't have to say number of pupil is one, because most often it is only one. Very rare to see polychoria where you see multiple pupils. So please don't comment. You only talk about size, shape, regularity, and location. The other next important thing is reflexes. Okay, we have to check for at least 2 reflexes. There are 3 reflexes: direct, indirect, and near reflex, but 2 reflexes you have to check. So in direct reflex, let's see, if I throw light onto the right pupil, the right pupil constricts. So direct reflex of the right eye, throw light onto the right eye, and you will see, shine torch on the right eye, and you'll see, look for pupillary reaction in the right eye. This is direct reflex. So the afferent pathway is right optic nerve, efferent pathway is right ocular motor nerve. This is direct reflex. Now the indirect reflex. Okay, now please, I'll be demonstrating the indirect reflex of the left eye. So concentrate on the left eye. I'll be throwing light on the right eye, but I'll be looking for reflex of the left eye. So when I throw light onto the right eye, you'll see that the left pupil constricts. So this is indirect pupil reflex of the left eye. In ophthalmology, what is the reflex that we see? If I see reflex of the right eye, then I call, and if I'm throwing light onto the right eye, I call it as right eye direct reflex. If I see reflex of the right eye, pupil constricting of the right eye, but I'm throwing light onto the left eye, I still call it indirect reflex of the right eye. Okay, so shine torch, indirect pupillary reflex of the left eye, shine torch on the right eye, and you will see, look for the pupillary reaction in the left eye. This is indirect pupillary reflex. You have to demonstrate these two. And but a near reflex, you have to know when you bring a object very close to the eye, um, then you will see, when very close to the eye, you will see that the pupils constrict, but not without the light. Okay, not necessary that you have to do near reflex in every patient, but direct and indirect reflex you have to demonstrate. This is also one of the competencies, so you have to know how to perform this direct and indirect pupillary reflexes. What is relative afferent pupillary defect? Where there is a relative afferent pupillary defect. The optic nerve of one side, it is functioning but not as properly as the other eye. So that's what we call it as relative afferent pupillary defect. Now, if you see that both the pupils will constrict, but the left pupil will be relatively sluggish compared to the right eye. So I throw light on the left eye. It is constricting, but not as much. Now, if you see the same thing, if I throw light on the right eye, it is constricting more briskly than compared to the left eye, right? You see that? And then you will do a swinging flashlight test. So right eye pupil constricts more than the left eye. Okay. When you throw light onto when you swing the light from the right eye to left eye, pupil actually constricts, but not much. When you swing the light from the left to right, it has already dilated and again it constricts. So this is what you call it as RAPD. So it's not a similar equal reaction in both eyes. If both eyes were functioning properly, then both pupils remain constricted equally. Whereas here, the left eye pupil dilates. As soon as you swing light from right to left, it dilates a little bit. When you swing back the light from left to right, both your pupils constrict. So this is called as relative afferent pupillary defect, or otherwise called as Marcus gun pupil. So in summary, when you're examining the pupil, you will comment. Please don't comment about the number of the pupil. You will comment about the size. What is the size, the shape, regularity, location, and reflexes, direct and indirect reflex. So when you're presenting the pupillary examination, you will say pupil 3 millimeter in size, round, regular, central, and reactive to direct and indirect reflexes. Thank you very much.